5 medical tests. Seniors over 70 should think twice about the alarming truth your doctor won't tell you. After 70, most people believe routine checkups are a safety net, a way to catch problems early and live longer. But what if I told you that some of the tests you're lining up for could actually push you towards surgery, stroke, or even cancer? New research shows up to 37% of medical tests in seniors lead to unnecessary treatments, dangerous complications, or lifelong side effects. And here's the part almost no one knows. 99% of people over 70 are being over-tested and paying the price. One of these so-called routine checkups, the number one on our list, is linked to 5% of all cancer cases in the US. The same as drinking alcohol every single day. You won't hear this from your clinic. You won't see it in a pamphlet. But the truth is buried deep in the science, and today, we're digging it out. In this video, you'll discover 5 common health checkups you should avoid after 70 and the disturbing, little-known risks they carry. Every point is backed by real science, and you'll be shocked at what landed at number 2. Tell us in the comments. Where are you watching from? How old are you? Have you ever regretted a test or procedure? We read and personally respond to every comment with tailored tips. And if you want more life-saving health insights, hit like and subscribe. Now let's begin with the first test. Number 5. Bone density scan. It sounds harmless, a quick, painless scan, no needles, and you walk out knowing if your bones are at risk for fractures. But here's what most seniors aren't told. Past age 70, a bone density scan, DEXA scan, can create more fear than benefit. The test measures bone strength to detect osteoporosis. But in older adults, especially women, results almost always show lower density, even when there's no real danger. That's because bone loss is a natural part of aging, just like wrinkles or gray hair. Yet many seniors are then pushed into taking bisphosphonates, drugs meant to strengthen bones, but linked to serious side effects, including jaw necrosis, a rare condition where the jawbone starts to die, and esophageal irritation. A Journal of the American Geriatric Society study followed over 1,200 women over 70 and found bisphosphonates reduced fracture risk by only 0.3% over 5 years, a minimal benefit. Meanwhile, side effects like digestive issues, esophageal inflammation, and even unusual bone fractures were far more common. Take Rose, a 76-year-old retired piano teacher. Healthy, active, never had a fall. After a routine DEXA scan showed mild bone loss, osteopenia, her doctor prescribed alendronate, a bisphosphonate. Within 3 months, she developed severe reflux and jaw pain and stopped playing piano. Once off the medication, we switched her to vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet with sardines and leafy greens. 1 year later, she had stronger legs, better balance, and no fractures. For seniors without fractures or falls, lifestyle changes, strength training, balance work, proper nutrition, and fixing vitamin D deficiency can reduce fracture risk by over 20%, according to a 2022 Osteoporosis International study. Don't let a number on a screen push you into risky medication you may not need. Number 4. Brain MRI for memory loss. When seniors start feeling more forgetful or confused, fear often takes over: fear of dementia, fear of Alzheimer's. Doctors, trying to help, often order a brain MRI. But here's the uncomfortable truth. These highly detailed scans rarely give the answers patients hope for. In people over 70, most MRIs show perfectly normal, age-related changes, slight shrinkage or white matter spots that mean nothing dangerous. But once those spots are seen, they can trigger a chain reaction of fear, more tests, and even brain surgery that may not help memory at all. and could actually make things worse. The 2021 Neurology Today review of over 3,000 MRI scans in patients aged 70 to 85 with mild memory complaints found that 86% showed some abnormality, but only 3% were linked to a truly treatable condition. That means 97% went through the stress of hearing something's wrong when it really wasn't. Even worse, nearly 12% were sent for invasive procedures like spinal taps or exploratory biopsies, all from vague scan findings. Consider George, a 74-year-old retired engineer. He occasionally misplaced keys and forgot names, but was otherwise sharp. An MRI showed white matter changes. Convinced he had dementia, he stopped driving and withdrew from his community. His anxiety skyrocketed. Months later, a standard cognitive test revealed his memory was completely normal for his age. We explained that his MRI findings were age-appropriate and helped him focus on sleep, hydration, and brain exercise. Within 3 months, his memory stabilized and his confidence returned. The truth is, unless there are severe neurological symptoms like seizures, sudden personality change, or rapid decline, an MRI offers little value for mild memory issues. A better first step is a simple cognitive screening test. It's quick, low cost, and avoids the spiral of unnecessary panic. Number 3, cardiac stress test. The cardiac stress test is one of the most common procedures given to seniors with mild fatigue, chest tightness, or simply not feeling like they used to. The test monitors your heart while you walk on a treadmill or take medication that simulates exercise, aiming to detect blocked arteries. But after 70, especially in people without clear signs of heart disease, this test can do more harm than good. In adults over 70, false positives results showing a problem where there isn't one can be as high as 40%. That means many are sent for further testing like angiogram and even unnecessary stent placements or bypass surgeries. A 2017 JAMA cardiology study found that over half of all stents placed after stress test referrals were done in patients with no real symptoms or benefit. These patients saw no improvement in survival or quality of life, but did face higher risks: bleeding, kidney injury from contrast dyes, and prolonged hospital stays. Just ask Raymond, a 75-year-old retired postman who stayed active by walking daily. He mentioned mild fatigue on hills during a checkup. His doctor ordered a stress test just to be sure. The results were unclear, leading to a catheterization, a procedure where a tube is inserted into the arteries to check for blockages. A mild narrowing was found, and a stent was placed. That night, Raymond reacted to the contrast dye, developed kidney problems, and spent 6 days in the hospital. Weeks of follow-up care later, his fatigue remained because it wasn't a heart problem at all. He just needed better hydration and more rest between meals. If you're over 70 and not experiencing classic cardiac symptoms, chest pain during activity, shortness of breath on exertion, or a big drop in stamina during light exercise, a stress test may be more risk than reward. Safer options include a resting EKG to check heart rhythm while you're still, or a coronary calcium scan to detect dangerous plaque buildup with low radiation and far less risk of being pushed into unnecessary procedures. Number 2, colonoscopy. You probably didn't expect to see this here, but colonoscopy, the procedure that uses a long camera to examine your colon, is not always a wise choice after 70 and is almost never recommended after 75 unless there are clear symptoms. The risks climb steeply with age. The prep alone, strong laxatives can cause dehydration, dizziness, or kidney problems. Sedation adds another layer of danger, especially to brain function in older adults, and the procedure itself can cause bleeding, tearing, or even dangerous heart rhythm changes during sedation. A 2019 JAMA internal medicine study followed over 1.3 million Medicare patients aged 70 and older. For every 1,000 colonoscopies done in patients over 75, only 2 lives were saved, while more than 20 people suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. Even when polyps are found, many in older adults are small and slow-growing. Removing them can sometimes cause more harm than leaving them alone. Take Dana, a 73-year-old grandmother who ran a bakery with her daughter. No symptoms, no bleeding, no family history of colon cancer, and 2 clean colonoscopies in the past. But her new doctor insisted on a screening. During the procedure, a small polyp was removed. That night, she collapsed with severe abdominal pain. Doctors found a bowel perforation. 9 days in the hospital, 10 pounds lost, and she's never fully recovered. The U.S. Preventive Services Task Force advises stopping routine colon cancer screening at 75 for most people. For healthy seniors wanting continued screening, a FIT test, a simple, at-home stool test, is a far safer option. No prep, no sedation, and it still catches most serious cases. Number 1, annual full-body CT scans. Full-body CT scans, often sold in executive health packages or private clinic checkups, promise to catch cancer early. But here's the harsh truth: they're more likely to cause harm than save your life. Each scan blasts your body with 10 to 20 millisieverts of ionizing radiation, about the same as 500 chest X-rays. And if you're over 70, the danger isn't just the radiation itself, it's the cascade of unnecessary follow-ups, biopsies, and surgeries it can trigger. And for what? There's zero evidence that full-body scans in people with no symptoms improve survival. A 2023 JAMA Internal Medicine modeling study estimated that rising CT use in the U.S. could now be responsible for up to 5% of all cancers, putting them in the same risk category as alcohol. CTs pick up harmless nodules, calcifications, or cysts, normal signs of aging. But once they're spotted, the alarm bells go off. More scans, more biopsies, more fear. Take Marcus, an 80-year-old martial arts instructor for seniors. He felt great until a private clinic offered him a senior elite checkup. A full-body scan found a tiny 3-millimeter nodule. He was referred to oncology, sent for a PET scan, then a needle biopsy. Result? Benign. But the biopsy collapsed part of his lung. He spent days in the hospital and needed 2 months to recover, all for something that should have been left alone. The American College of Radiology is clear. Full-body CT scans should never be used for general screening in people with no symptoms. If you have red flag signs like unexplained weight loss, coughing up blood, or visible swelling, targeted imaging makes sense. But scanning your entire body just to see is like treasure hunting with a landmine detector. You might find something, but you could do more damage than good. The safer path? Listen to your body. If you feel well, stick to regular checkups with your doctor and only get tests you truly need. Your time, energy, and health are too valuable to waste on fear-driven screening.